If you are studying for the ICE component of the DANB exam, this might be the most important video you watch all year. Hey DA fam, it's your girl Leela. Who else? And welcome to
the DA Study Spot, yeah.
Today, we are breaking down Chapter 19, Disease Transmission and Infection Prevention, straight from the MDA 15th edition textbook. Now, I know we've already had a study session based on infection control, but it is an important topic and it is everywhere on the DANB, so we need to lock in. This chapter is the foundation of everything infection control. So if you're taking that exam, pay close attention. This one is for you. Let's get started, but before we do so, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Run it! First things first, everything in infection control starts with the chain of infection. The book describes it as a chain with 6 links, and every single link must be present for infection to occur. You break one link, you stop the infection. That's literally the whole job.
The 6 links are: number 1, infectious agent. This is the pathogen. Could be a bacterium, virus, fungus, parasite, or prion. Then the second one, reservoir, where the pathogen lives and reproduces. In dentistry, reservoirs include saliva, blood, feces, water, the environment, animals, and insects. Third, portal of exit. This is how the pathogen leaves the reservoir. So examples, secretions, excretions, droplets, and aerosols. Then mode of transmission. This is how it travels. Direct contact, indirect contact, droplets, or airborne. Then fifth, portal of entry, how it gets into the new host. So inhalation, ingestion, mucous membranes, or broken skin. And then susceptible host, a person who cannot resist pathogens.
Infection control strategies are designed to break one or more of those links. That's what every glove, mask, and sterilization procedure is doing. So the book breaks down transmission in a way that is really specific to dentistry, and the DANB loves this.
First breakdown is direct transmission. This is person-to-person contact. In dentistry, that's contact with a patient's blood or saliva, droplets from sneezing or coughing, or spatter produced during treatment. Then indirect transmission. These are microorganisms that are transferred to an object or surface first, then onto another person who touches it. For example, a dental chart handled by a gloved assistant, then picked up by the receptionist with bare hands. Next, there's airborne transmission or droplet infection. These are droplets of moisture-carrying bacteria or viruses. Chapter 19 shows 3 different categories. Droplets under 100 microns travel 0 to 2 meters. Particles under 50 microns travel 2 to 4 meters, and droplet nuclei under 5 microns can travel beyond 10 meters and stay airborne for extended periods. Then there is blood-borne transmission, which is through direct or indirect contact with blood and other body fluids. The book specifically calls out hepatitis C, hepatitis B, and HIV as blood-borne diseases of major concern in dentistry, hence why hepatitis vaccines are recommended. Last transmission is parenteral transmission. This happens through cuts or punctures in the skin. So think needle stick injuries, human bites, cuts, and abrasions.
Now here's a distinction that trips students up on the DANB. Standard precautions versus universal precautions.
Universal precautions is the OSHA-based concept. This is treating all human blood and certain body fluids as potentially infectious. Then you have the standard precautions. That's the CDC-based concept. It expands on universal precautions to cover a broader range of body fluids and applies to all patients regardless of known health status.
They coexist, so know both terms and what each one covers. Hand hygiene is a performance outcome in this chapter, meaning you need to be able to actually do this correctly, not just know about it. And the book covers 2 steps.
Routine hand washing, which is just the use of liquid soap. You never use bar soap. It can transmit contamination. You wash your hands before putting on gloves and immediately after removing them, and anytime hands are visibly soiled. Next is the alcohol-based hand rubs, or we call them sanitizers. These are preferred over soap and water in most clinical situations where hands are not visibly soiled. Concentrations of 60 to 95% are most effective. But if your hands have visible blood or saliva, you go straight to soap and water first, then follow up with the hand rub. And the third one is surgical hand antisepsis. This is for surgical procedures. You scrub hands and forearms for the time recommended by the manufacturer, which is usually between 2 to 6 minutes. Remove rings, watches, and bracelets beforehand.
One more thing the book flags, and my girly girls are gonna hate this. We are not to wear rings or artificial nails in the dental office. I know, who am I kidding? But they harbor pathogens and tear gloves. I know.
Now, if you are already a dental assistant, then you know PPE must be worn whenever you're performing tasks that produce splash, spatter, aerosols, or contact with body fluids. Examples of PPE: protective clothing, surgical masks, face shields, protective eyewear, disposable patient treatment gloves, and heavy-duty utility gloves. There is an order in which you put your PPE on, which is called the donning order, and we did speak about this in our infection control one-on-one study session previously, so you should be familiar. But if this is your first study session with me, then the order is protective clothing, then face protection, then gloves last. Since gloves are the last to go on and the most frequently changed throughout the day, you are going to remove PPE starting with the gloves first to prevent contaminating your hands, clothing, skin, and mucous membranes. Now, if you didn't already know, mask has 3 different levels. Level 1 is the performed mask. This is for physical barrier only, for procedures with no fluid spray or aerosols. Level 2 masks are surgical masks for low to moderate fluid spray and aerosols. And level 3 is a surgical N95, which is for moderate to heavy amounts of fluid, spray, and aerosols, and for treating patients with airborne diseases.
Key mask rules from this chapter: change between every patient or when it becomes damp, handle by the sides only, mask should not contact the mouth when worn, and never wear below the nose or chin, especially not during a procedure.
Eyewear is also extremely important, and there are 2 types: glasses with protective side shields and then the clear face shield. The BBP standard requires both front and side protection. All right, raise your hand if you knew there were 4 types of gloves. 4 types of gloves are your examination gloves, which is the vinyl all nitrile. This is the most common and single-use glove that we use every day. You have your oval gloves, which is worn over exam gloves to touch clean surfaces or objects during treatment without contaminating them. Your sterile surgical gloves for invasive surgical procedures, and your utility gloves, which is not used for direct patient care, but instead for cleaning, disinfecting, and handling contaminated instruments. They can be washed, disinfected, or reused, but must be discarded when they can no longer provide barrier protection.
Section 6 is the last section in this study session: latex allergies. There are 3 types of latex allergic reactions, and it is testable.
First is irritant dermatitis. This is the most common but not an immune response, caused by chemical irritation from frequent hand washing, soaps, or the cornstarch powder in gloves. Skin becomes red, dry, and irritated. This has happened to me before. Then you have the type 4 allergic reaction. This is the most common type of true latex allergy. Its delayed contact reaction takes 48 to 72 hours for the red itchy rash to appear and involves the immune system. And the third is the type 1 allergic reaction, which is the most serious and can result in death. Symptoms appear within 2 to 3 minutes of contact and can trigger anaphylaxis caused by latex proteins, not the chemical additives. If you already attended last study session, chapter 31, then you know that this one is life-threatening and 911 should be called.
If one employee in the office is diagnosed with a latex allergy, all staff members should follow practices to minimize latex-containing products within the office. All right, y'all, that is chapter 19 and your exam foundation right here. If you want more practice before exam day to help you prepare, click that link in my description box. All my materials are designed to help you pass your exam on the first try. Know what to expect so you can walk in with confidence. Click that link. If you found this video helpful, don't forget to like, save, and subscribe. Then share with a DA bestie, and I will see you both at the next study session. Bye.
The DA Study Spot, yeah.